Hello everyone, my name is Dr. Ben Glassman from Fairfax, Virginia, from the Chiropractic and Physical Therapy Center. It's October, and October is Chiropractic Health Month. Now, chiropractic is a form of healthcare that is the largest form of healthcare that is non-medical, specifically holistic healthcare, trying to help the body heal, and millions across the world use it every day. And chiropractic care is a very unique therapy that I find near and dear to my heart because of the effects it had on my life and on my loved ones. Because the whole goal of chiropractic care is to get the body healing naturally without the use of drugs and surgery, which absolutely have their place, but the whole goal is to help the body heal as best as it possibly can to its 100% of its capacity by really aiding and nurturing the most important organ in the human body, our brain. Our brain and our nervous system runs through the spinal column. That's actually the only reason why chiropractors even care about the spine, because what it protects. And that's oftentimes misconstrued. The whole goal is to take the pressure off these vital nerves to allow our body to function at its best. Because truly, it's the brain that runs the show. The brain sends messages down the spine through all the nerves that go to your heart, that go to your lungs, that go to your digestive system. All the nerves in the human body branch like a tree, exiting the spine, going to your organs, going to your muscles, and going to your skin. And when that nerve is irritated or compressed or damaged, it can cause pain, it can cause problems in the muscles, causing aches, because classically chiropractic patients, a lot of them coming in the door, come in for pains like back pain, neck pain, headaches, migraines, injuries. And that's really the tip of the iceberg, because we love helping people get better naturally. But the whole goal is we're technically not treating the body, we're taking pressure off these nerves, going to these muscles so the body can heal itself. So in reality, the whole goal is to have our nerves function optimally. So that nerve that goes to your lower back also goes to your colon. It also goes to your bladder. And when that nerve is impinged or irritated, it can affect digestion, it can affect the way our sphincters work, it can even cause incontinence and all sorts of issues where that nerve goes to. So in that sense, we're truly not healing the body is healing itself once we allow that body to facilitate properly by aligning the spine and taking pressure off these vital nerves. Now, this was the actual message of chiropractic when it was first created in 1895. A man named D.D. Palmer, who was a natural holistic healer, didn't know much about, well, there's no chiropractic at that time. But what had happened was he was a magnetic and holistic healer. A man named Harvey Lillard came into his office, and he had actually 17 years of his life, in his adult life, had most of his hearing was gone. He had mentioned to D.D. Palmer that he had this crick in his back, it just made a pop noise, and then all of a sudden he stopped being able to hear properly. D.D. Palmer met the man, and as he was examining him, he saw a large lump on the back of his neck. And as crude as it was, he saw that there was a spinal joint that may have something to do with it, and not knowing what he was doing, he just took a crude adjustment and took pressure off of some of the nerves, and after that period, his hearing started to come back. After 3 consecutive adjustments, Harvey Lillard had his hearing returned to him, and not that D.D. Palmer cured hearing, but he took pressure off of some of the nerves that we now know go through the thoracic cage and the cervical spine that can relate to some of those cranial and cervical nerves. So the whole goal is to take pressure off the nerves, and it's very interesting to me that the very first chiropractic patient was not a patient with back pain or neck pain, but actually affected his hearing. Now, 2 years later, the first school of chiropractic was created, and from that point on, it was developed into a much more legitimate science. His son, B.J. Palmer, was credited as being the developer of chiropractic, and he took science and the philosophy of the natural healing of holistic health, combining it with what we know about the nervous system, and started to chart and understand more about how chiropractic can help patients. Back then it was considered that it's kind of like a garden hose. You take pressure off the nerve and the nerve flows the energy properly through the body. And then through decades and decades of research, we now know much, much more about the nervous system. And in my opinion, because I specialize in neurology, I usually use more up-to-date analogies. Really, our nerves aren't like a garden hose because you can put a lot of pressure on those nerves. But it's kind of like your cell phone going to the satellite in the sky. It's not going to be life-threatening all the time. Sometimes it can be, but when those nerves are irritated, they're not going to fire at the same conduction speed. It's kind of like having 2 bars on your cell phone instead of 5. So your body won't be as receptive. You're going to be oftentimes in pain, but a lot of systems in the body don't function the proper way they're supposed to. So patients throughout the generations have seen improvements with asthma, improvements with digestive complaints, improvements with arrhythmias and heart issues as well. But again, we're not treating these conditions, we're taking care of our nerves so our body can heal itself naturally. It was actually only until the 1970s that chiropractic was even looking at musculoskeletal conditions like muscle pains and aches. But the clear delineation is understanding how the body heals itself. Chiropractic in Greek terms means chiro, and practic actually means roughly hand and done, i.e. done by the hand. So it is a natural form of healthcare done by, in this day and age, tools, instruments, and hands for the same goal and purpose, for the body to do its job and to do it optimally without any interference from any stress on the spine and nerves. So the whole goal is to help the family stay healthy. We see lots of children, adults, geriatrics of all ages, because if you have a spine, if you have a nervous system, then you should see a chiropractor, even for the simple purpose of just getting checked to see if your body's functioning optimally as it should. So that's the goal of this month, to spread the message that's not just about pain. We want to look beyond that and focus on natural healing and optimizing the body's health. I'm Dr. Ben Glassman. Thank you so much for taking the time to watch this video.